It seems Brazilian butt lift is more and more common. Where did the process come from?
It is. The so-called Brazilian butt lift is essentially liposuction and fat grafting to the areas of hip and buttocks. And it is becoming a more popular procedure because patient awareness. And when you look at the data from the American Society of Plastic Surgeons, it has actually last year an increase of 40% with this procedure. So it's a procedure that is being as patients become more aware of the procedure, then there is more demand for this. It is a wonderful procedure, and I say wonderful because these changes is a body contour procedure that is safe, and it has dramatic results.
Describe the procedure that you perform.
Essentially, it's a liposuction procedure. It's an advanced liposuction procedure that involves all layers of the fat of the skin, including deep areas of liposuction and superficially as well. So it's an advanced liposuction, liposculpture procedure that, and fat grafting to areas of the hips and areas of the buttocks. So it's advanced liposuction with fat grafting to the buttocks. There's really not, the scars are small scars. It's just for the liposuction cannulas and for the injection of fat injection. So they're very small. They're in the order of 5 millimeters.
Do you ever use implants?
Well, implants have been used by many surgeons, and including me, to enhance the back of women, but they have a place. And honestly, I use implants less and less. Very rarely I use implants.
And do you ever save the fat cells so maybe you could go back and reshape the work you've done?
I don't. I use the fat cells immediately after. I don't like to freeze them as storage in the refrigerator and try to inject them again. I don't do that. I inject them right away. That has the best chance of survival.
Do I have to sleep on my stomach after the procedure?
I think it has changed over the years. Especially, I used to be one advocate where I even write about. I used to teach that after a Brazilian butt, refrain from sitting for 3 weeks, 4 weeks, but in reality, I don't do that anymore. Patients go right after the procedure, they sit on the car and they go in the front seat or the back seat and they're sitting down and they go home. Mm-hmm. What I try to tell them is try not to sleep on your butt, sleep on your side for 1 or 2 weeks.
How long do the results last?
Results are permanent results because those cells that you remove from certain areas, as any liposuction or any liposculpture results, even if you gain weight, there's less fat cells in those areas, so you're not going to gain weight in those areas.
If I work 5 days a week, sitting 8 hours, 9 hours a day, how soon can I go back to work?
Most of my patients go back to work within a week.
And how soon can I work out after the surgery?
I tell my patients to wait for at least 3.5 weeks, 4 weeks before they endure any exercise activity.
Now, I understand there's a compressive garment included in this procedure. How long do I have to wear that?
About 6 weeks. Compression is.
Are there any supplements that maybe I should take before a procedure like this?
Well, living a safe and healthy life is important, meaning eating properly and exercising and a good diet is always a good thing to have. It gives, I guess it's because it has dramatic results. And those dramatic results are are measured in patient satisfaction. When I look at patients, this is one of those things that, one of those procedures that patients really love it. They just go, they just absolutely love it.
Health Matters will be right back.